Hey everyone, welcome to a special episode of Why Should I Trust You? It's election day in many parts of the country. Now, only a handful of states are voting, but if you're like us, you feel like we're building towards an election every day, like we're living in a spin cycle of non-stop political combat. So you might think what we need right now is less politics in our lives, a break, some neutral ground. Enter our friend and guest today, Dr. Craig Spencer. Craig wrote an article recently that we instantly knew would make for a different kind of Election Day episode. And if you think the friendly, affable Dr. Spencer might be arguing for a move away from politics for public health, you'd be wrong. On this Election Day, a move toward more political confrontation is exactly what Craig is calling on public health to do. Now, not partisan politics, but political in the sense of mobilizing people to vote for what they say they want, what they value. Cleaner air, safer food, prevention that actually gets funded. It feels like a tall order for public health at a time of profound change. Some call it a reimagining, others say dismantlement. But if you look past the horse race and the polls, he might just be onto something. Let's get started. Hi, guys.
Hey.
Hey, welcome.
It's Brenda Adhikari here, along with Tom Johnson and Maggie Bartlett. Mark is going to be back later on in the week. Wait, can I just say something about Mark? I don't know if our listeners know this about Dr. Mark. He is a full-time working physician.
Yeah.
He's a full-time doctor. The reason he dresses in scrubs is because he's like being a doctor. He's a surgeon.
Right, but Brenda, where is his priority? Like, what is his priority?
Right, like why is he not podcasting?
Yeah, why is he not podcasting?
So rude. But anyway, it's just a little shout out, like appreciation note for Dr. Mark, full-time working doctor who podcasts from an exam room, not while he's seeing patients, let's be very clear. But he is going to be back with us later this week. So look, Craig Spencer, his Substack, as soon as it dropped, I texted Craig being like, you need to come on the pod because this shit it's fire. So I can't believe I just said that, by the way. This shit is fire. Like what like, am I like 20 years old?
You're going to start saying 6'7" next.
Oh my gosh. Okay. We have a whole other podcast planned for 6'7". We're not going to do that right now. Okay. So Craig Spencer, this article is called When Public Health Forgot to Fight. So we called an audible, which I believe is a football term, and said, Craig, you got to carve out a little time to chat with us about this one.
Yeah, and with Election Day here, whether you're voting or looking at this as a kickoff for next year's super critical midterm elections, we couldn't think of a better way to focus and move the focus back to public health and medicine and science and trust, our lane, than to talk with Craig about the politics of public health and what's missing here. Craig, no shocker, thinks there has to be a big change.
That's right. And let's just tell you a little bit about Craig. So Dr. Craig Spencer is an emergency medicine physician and an associate professor of the practice of health services, policy, and practice at Brown University School of Public Health. He focuses on frontline preparedness in U.S. and around the world. Hi, Craig.
Hi, Brenda. Hi, Tom. Hi, Maggie.
Hey.
It's really good to have you. And also, we should say Craig has been on the pod multiple times. He has been a part of those conversations with MAHA. So he is a friend of the pod. Okay, Craig, let me just start off with this question, which is the headline itself, When Public Health Forgot How to Fight. And then you go on to say, history shows that public health has never advanced by standing above politics. It has advanced by wading into it. Tell us about that. What do you mean when you say that?
What I mean by that is that if you look at the history of medicine and public health, which I do as someone that teaches on what I call the historical determinants of public health in a class here at Brown University, and the class usually when I'm done every day teaching, I'll just write up my reflections, 1,000 to 2,000 words, and I don't mean to share them broadly. It's the first time that I've really done it. So I'm glad it landed in your inbox and that it resonated with you. But this was mostly just to go over what I chatted about with my students who helped create this amazing dialogue. And what we do is we go back and we look at history. And I say to them, at this moment, we have heard so much about how we need to take politics out of public health and depoliticize it. And the problem with public health right now is that it's too political. And I argue to them that that's not the case, that we've maybe made public health too partisan, but that if we as a field, if we want to go forward, if we want to be stronger, we need to bring the politics back into public health. And that means fighting for better healthcare access, for improving the amount of investment that we have in public health, for thinking about environmental protections, all those things that we think about as public health. We need to fight for them because never has our field advanced by being subsumed by another, by standing back. The history of public health is built into social conditions 170, 180 years ago. We need to think about those if we want to move forward.
So, Craig, I want to ask you specifically about that because, as I was reading it, it really struck me that you're talking about a public health that at the same time it was kind of parallel to the labor movement in this country in many ways. Tell us a little bit about that. Like, what is that history that leads you to say, man, we got to get back to that era in some ways?
So if you look back to when modern public health began, we're talking about the 1840s, 1850s in the US and in the UK. And there was this guy, Edwin Chadwick, that wrote this thing on the social conditions of the working population. And his argument was not one that he was convinced of these liberal values and that we all, needed equitable access to care. He was concerned about the fact that if you were sick, you were not working. And we needed to decrease the number of people who were sick so that they could work. And this resulted in an 1848 set of laws in England that were followed in the US just a couple years later. And these were based on social conditions. The fact that you need access to clean water, you need access to clean air. Now, part of the problem was that at that point, the understanding of disease was such that people thought disease was in the air. They believed in miasma. And they didn't have a bacteriologic understanding, or they didn't know about viruses. They didn't think about contagiousness the way we do today. The result was that people said, listen, maybe we don't have shared living conditions. I might be wealthy and live a mile from you, but we share the same air and we may share the same water. And so that we all collectively have a responsibility to improve the sanitary conditions of our living environment if we all want to be healthy. This was everywhere. It resulted in unbelievable advancements in data visualization. We took a lot of that here in the US and we used a lot of those same arguments for improving access to clean water, for improving access to a lot of what we now call social determinants of health as the only way and the political way for us to advance. These were all based on political arguments and political premises to move the field forward.
And do you think that's not happening now? Why is that something that inspires you, those actions back then? And somehow, describe the shift that you see is happening.
Well, what I see right now as someone that's worked in emergency medicine now for 2 decades, I see medicine as intensely political, but very rarely do we call it such. And I see public health as the field that needs to be more political, that I don't think is political enough, but that we often lob the accusation that it is being overly political. Let me go back just a bit and say that 100 years ago, physicians in the United States were just like a wily crew of folks. Some were unregulated, some were not. In 1910, there was this big report that came out that said half of the medical schools in this country need to shut down. There were these parchment mills where people would get a diploma and hardly even touch a patient. And groups like the burgeoning American Medical Association and others realized that they needed to get authority to have a political push. And medicine went from being this incredibly unregulated and often untrustworthy field to what we see now as one of the most politically active fields. The AMA has one of the largest lobbying budgets of anyone. And we see the intense involvement of politics in medicine today. Yet despite that, the overwhelming majority of people still profoundly trust their physicians. On the other hand, public health has moved out of politics. It was largely subsumed to the big push and the big rise of medicine over the last 100 years and has played more of a supporting role to provide the statistics and the background and the epidemiology to try to argue for some of those conditions, to help doctors argue amongst themselves whether statins are beneficial or not. And so I see more of a supporting role. And look, there are outliers here. This is generalization. There's certainly a lot of people in public health that are trying to be political in different ways. But the reality is that today you have this divide, or what we see as this forced divide between public health and between medicine. And medicine is about the individual, and medicine is about doing everything at the patient's bedside, and public health is the community. And the reality is that this is an artificial divide that we have created. We have created the conditions in which right now medicine is fiercely and intensely political. It is involved in a lot of lobbying. It is involved in a lot of the political decisions, as we're seeing right now, around this government shutdown and the question of ACA subsidies as people see the potential rise of their ACA premiums next year. But we see at the same time coming out of that pandemic, so much concern from people who saw and experienced during the pandemic a medical field which they thought was heroic. They came onto the streets, they banged pots and pans, they said, thank you so much, medicine, for everything that you did. But then went and lambasted a public health field that they thought was being too political at a time when we needed public health to be bold.
So, Craig, you quoted Edwin Chadwick. I want to quote somebody else. The fictional character Howard Beale from the movie Network, who was a newscaster and uttered into the TV camera, I want you to get up now. I want you all to get up out of your chairs. I want you to get up right now and go to the window, open it, and stick your head out and yell, I'm mad as hell, and I'm not going to take this anymore. This feels like your Howard Beale moment. You're both a physician and a public health person, and you're like, enough. Like, public health has been kicked too many times here. We've got to get up off the mat, and we got to fight, and we got to get politically savvy. Otherwise, we're just gonna recede. I think you said it's like 4% of the spending on health goes to public health versus 96 goes towards medicine. Like, we're gonna just see 3, 2, 1%. I mean, just talk about this mad as hell moment for you.
Yeah, I'm definitely mad as hell, particularly coming out of the pandemic. But let me say that I don't think that my proclivities have kind of fit on one side or the other, even though initially I was a physician and later started working in public health. You know, as we find ourselves in this moment of kind of, quote, traditional public health versus MAHA, which I think is overly simplistic and, overlooks the overlaps. I'm someone that even during medical school, I thought was absolutely crazy that pharmaceutical companies could come to the offices I was working in and like sell drugs. Like, this is bananas. Why are we allowing this to happen? And I fought for over the past decade for equitable access to treatments, vaccines, things like that here in the US and internationally. I thought that pharmaceutical companies did have too much power and spent too much of their money on, advertising and direct-to-consumer advertising versus things like research and development and equitable access. And so I've kind of been in this weird spot for a while, my whole medical career, thinking, what are we doing and why are we doing it this way? Recognizing that the system is broken. And even before MAHA even existed, kind of penning a proto-MAHA argument about why we only spend pennies on the dollar on public health, why it leads to us having the worst health outcomes in the developed world, why are we spending $4.3 trillion to prop up a medical system that is overly focused on things like management of chronic disease as opposed to preventative medicine. And none of that is because I think I was a proto-MAHA. I think it's because I've been in public health and in medicine for so long that I was able to see that I could go into the emergency department and take care of patients, and I could send them back out into a system that is Kafkaesque and crazy, and people's biggest concern was not whether they were going to feel better sometimes, but how much they were going to have to pay for my visit. And I realized that I worked in the most accessible part of healthcare. For me, I don't have to ask about people's insurance. I don't have to ask whether they're documented or not. I realized that for me, despite how frustrating and crazy it was as a provider to see what people are going through, it was nothing compared to what I'm sure Dr. Mark or others have to, and nothing compared to what patients must feel. And so I see this disconnect between what patients and the American public will say when you ask them on a survey about who do they trust, and they say, only 50% of Americans trust the CDC, despite the fact that public health is responsible for the doubling of our life expectancy over the past century globally. It's unbelievable. We've all been given an extra life to live, largely because of public health measures. But at the same time, we have a field where people go to the doctor, can't afford it, sometimes don't go to the doctor because they can't afford it, can't access it. And yet physicians get 80 to 90% ratings when it comes to trust. And I think part of it is because we get people so sick because they can't access the preventative care that they end up seeing a physician and their life literally depends on that physician or that provider being right for them, on that medical moment really converting them and making sure that they're healthy. And so their life is truly in these hands, as opposed to being able to see all of the stuff that comes before, all of the invisible things that public health does, even with just pennies on the dollar, the incredible impact that we've been able to make. And so, yes, I am out here pulling up all the windows and screaming and yelling and saying we need to do more. I recognize also that we as a field need to understand where our shared overlap is at this moment with politicians who perhaps many of us don't necessarily agree with their focus, agree with their approach, or even agree with what their priorities are. But I believe that there's opportunity in entropy, and I believe that this moment represents the potential for us to move forward public health in a way that redefines this narrative of a public health is only for communities and medicine is only for individuals. One should be political and the other one should not.
We talked when we were working on the open about this moment for public health, a reimagining versus a dismantlement, and it depends on sort of where you're coming from, how you see this moment. You wrote that, RFK is right about his diagnosis of this problem, that we just blow through prevention and we just end up treating downstream the problem. And we need to come back to the prevention piece of this. I'm just wondering, is it possible that aligning with MAHA, I know this is kind of crazy, but like aligning with MAHA, you could make it so it's not the dismantlement of public health, but actually the saving of public health. Like they are energized over prevention. You are energized over prevention. You both want to put more energy, more resources into prevention. Right now, I don't think you all see it the same way in terms of what exactly prevention is and how it should be invested in. But do you see a way where you guys could align and perhaps bring public health back to life and make it more robust?
I think it's a great question. I also think that, quite frankly, public health and MAHA need to align. I don't see a strong future for either without the other. And I say that because, yes, what has happened right now in this moment with RFK Jr. and Trump and this administration dismantling a lot of the same protections that they promised to want to offer. Things like environmental protections through the EPA that have been dismantled, access to some of the really fundamental work that occurs at the CDC, et cetera. I completely agree. And the dismantling of those capacities is destructive and self-harming. But when we look more broadly, the fact that in the span of just over a year, MAHA didn't exist a year and a half ago, right? It's just about a year old. And in the span of a year, we've gone from 0% of the public supporting it because it didn't exist to nearly 50% saying that they support MAHA or are MAHA curious. And I think the overwhelming number of those people are not people that are just like out there, waving a syringe and would call themselves like crazy anti-vaxxer conspiracy theorists. I think the majority of them are people like myself that say, look, I've tried to be in a healthcare system that does not make me healthy. We've said this before. Everyone in public health has said this before MAHA existed. There are many places of shared concern and overlap that we need to work together. I think that right now, the majority of my colleagues in medicine would argue that pharmaceutical companies should not have direct-to-consumer advertising. I don't think it benefits patients. I haven't seen anything that's, any evidence to say that it makes patients healthier or better outcomes. I know that it works well for pharmaceutical companies for their bottom line. I agree with RFK Jr. I would actually like him to go further. I would like him to find a way to get all of direct-to-consumer advertising off TV and out of print. There are places like that where we need to recognize our shared values. But I also think that we as a field, and I say, quote, public health and, in quote marks or traditional public health, the public health that, in a sense existed before RFK Jr. I think if we want to really push forward the agenda that's important, the one where there is overlap, and also to protect the things that we are most concerned about, namely, the cutting down and the restricted access to vaccines, I think we need to engage in these spaces where RFK Jr. and the MAHA movement is right? On pharmaceutical companies, on, corporate interests in medicine. I wrote this in the Substack piece. If you go to the pages of our biggest medical societies, AAP, American College of Obstetrics and Gynecology, the American College of Emergency Physician, which provides my board certification, they all have corporate sponsors, all of them.
Yeah, I went and checked. It was like Biogen and all that
Pfizer
stuff in there.
And Merck. And look, maybe there is a firewall between the decisions that are made in professional societies and the money that they get from their sponsors. Maybe there is. But if you look in the American College of Emergency Physicians, they list what you get for certain tiers of donations. And the highest donation gets you a sit-down meeting with leadership. Like, I think we as a field, medicine and public health, if we want to be immune against the attacks of money being involved in decision-making in public health and medicine, we need to recognize where we're wrong. And here we're wrong. When people call us out and say, how is the American College of Obstetrics and Gynecology going to, counter this claim? How is AAP going to show that it's independent of vaccine manufacturers? Stop taking the money. Just stop taking the money. And I'm sure there'll be colleagues of mine that completely disagree and will say that it's firewalled and it's not a conflict of interest. If that's the case, I don't understand how we prove it, particularly at this moment. Maybe it was fine before, but this is what I'm saying in terms of our own politics, in terms of the things that we need to focus on and think about. It's exactly this, like find places where there's overlap, where we have mutual concern, work together, recognize places where, where there is legitimate criticism for things that we can and should do better, work on those, show that we are true and like thoughtful interlocutors here, and then work together on the things that we really need to and want to protect, which are things like access to vaccine, environmental protections, all the things that, quite frankly, public health has been working on for a really long time. I know there's going to be public health people listening right now that are saying, we've been working on these things for decades. We've been doing this forever. I recognize that. The difference is that right now, this administration, particularly RFK Jr. and Marty Macri and others, they're doing action. They are doing things. And I think MAHA is an incredibly effective political movement, and that they are doing things. And even if the things that they do, a lot of people don't agree with, I've talked to a lot of people that said, the Tylenol stuff and the autism stuff, I think it's crazy, but they're doing things. And I'd rather see them strike out once or twice and try 10 different times as opposed to get nothing done. And what I see from a lot of people is having an apolitical public health that doesn't fight or is not seen to be fighting. And there's a whole documentary on PBS about the invisible shield, public health. And I hear people talk about how public health needs to be invisible. And that's what we have been, but we cannot and we should not be invisible. And if you're going to be invisible, we cannot be surprised when we come up and, emerge to close things down and people get angry and pissed at us. If we want to be protected, we need to be political. And to be political, we need to be visible.
Craig, I really love that. I think it hits on a lot of ways in which I'm seeing the shift in how we respond to public health and how we, as scientists, put ourselves out there more, especially in what is a scary time to do so. And I just want to hit on something that you said about funding for some of these organizations. Medicine itself, you've called it moved into a business, a money-making mode, where public health didn't. And that's some of how these different medicine organizations accrued power. And as we're in this inflection point for public health, I've heard a lot of people say we should mirror what's been done in medicine. But I'm also hearing from you that maybe that isn't the answer. How would you approach what public health should do next to really drive action?
Yeah, that's a good point, because I just don't want public health to take medicine's lessons and then copy paste them. Look, let me just say a couple things here first before I answer your question, Maggie, but it's a great question. I have profound respect for my medical colleagues. When I go to the physician and work with people, like, they are unbelievable humans. And the quality of care that you can get in this country is like unsurpassed in many places if you have access to the right insurance, if you have access to the right providers, which we all know is not necessarily homogenous across this country and across different groups. Let me also just say that, like, I don't want this to be seen as a criticism of the public health folks that are like out there doing this work right now. I don't want it to be seen as some type of like justification for what I see are horribly detrimental and just like really dumb dismantling of public health, many public health institutions over the last 6 to 7 months. And so when I say that I think that we need to be political and public health needs to be political, it's exactly to that point. Medicine is out there. It is out there so much. It is so political. I think AMA has a lobbying budget of like tens of millions of dollars, right? They are part of every conversation, every decision. And I think some of that is probably justified. I want someone fighting for good medical care in this country. But at the same time, we need someone fighting for good public health in this country. At the same time, RFK Jr. says that he wants to do a laundry list of things. They're trying to slash the budgets of the National Institutes of Health. They are cutting thousands of people from the FDA and the CDC, which I guarantee, despite their promises, are going to make our food and our health less healthy and more dangerous. And so what I want from a public health that is political is to show itself. Why don't we have on all the parks that people go to, the logo of the public health organization or the local public health department? Why don't we make it so that public health is more visible? I think there are things that we can do that is not going to change overnight. It took a century for medicine to go from this wayward, largely unrespected profession to the one that we have today that holds incredible political sway. Public health is not going to be, I think, reinvigorated and find its political footing again overnight. But it's a process that we need to continue to engage in. We need to be thoughtful about how we improve it. And I think that there are really brilliant ideas from many of the folks that I hear on the MAHA side. Let's focus on the environmental protection. Let me tell you, the MAHA Action Group and the other kind of big organizing people and groups from the MAHA side are amazingly political, are incredibly well organized, are great at grassroots action and getting people to do things and write things. I will say that I do not agree with nearly anything that comes out of the Children's Health Defense, but oh my gosh, should public health and should others find a way to think about their action and the way that they're able to communicate and engage with people in a way that moves them to do things, to write, to be passionate, to care.
Craig, let's talk about the phrase public health. So in your Substack piece, you have this part where you say, if public health is everything, sidewalks and sewers, vaccines and violence prevention, climate and classrooms, does it risk becoming nothing? And then you go on to say, it's a fair critique, but the answer isn't to make public health small. It's to make its politics precise. Name the levers, build the coalitions, show the receipts. So that resonated for me because I'll tell you, I have a heck of a time when I use that phrase, public health, because I never know exactly what I'm saying when I say the phrase. In my head, as a lay person, I am saying, I think in my mind, all that list you mentioned in your Substack, I'm like, it's the New York City Health Department making sure I can get pizza in a clean restaurant. It's like, it's vaccines and making sure that my kids get vaccinated before they go to school. It's making sure I'm recycling. Like, I don't know what the fuck public health is. I'm just going to be really real with you. Is that kind of an existential problem in public health? Has it always been that? Has it always been used as actually a badge of honor that it's so many things? And do you talk to me a little bit about that?
Yeah, I think it's a fantastic question because this was the tagline for the public health school I went to at Columbia and got my MPH. And their new tagline was that public health is everything. And it shows a wheel of hundreds of things that public health is. And I look at them all, I'm like, yeah, it kind of is all those things. But what we've come to define public health as is not medicine, right? There's medicine and there's public health. Medicine is like the individual care and all that stuff. And then anything that's not that could be public health. Do I think that gun violence is a public health problem? 100%. Do I think providing access to clean air so that people's asthma doesn't get worse is a public health issue? Yes. Our umbrella is really, really big. And part of what created the field of public health and its distinction from medicine was the recognition that, initially we had engineering and we had sanitation and we had a couple other things that were part of public health, but now we got biostats going into this and we have all these other overlapping fields and things that are getting much bigger. We need to cut this off from medicine. And that's largely what happened in the 1910s with the Flexner Report in 1910 and 1915 with the Welch-Rose Report that kind of standardized public health as this investigational, kind of more quantitative focused field to provide support and saying that we need people to have some skills in all these things, but man, public health is growing so big and the umbrella is getting so big that we can't be as part of or, really, just another appendage to medicine. And what's happened over time is that we've recognized that all of these things, what we now call social determinants of health, do impact our health. People have probably heard that your zip code matters more than your genetic code when it comes to certain health outcomes. We know that's true. We know that things like redlining that happened decades ago still continue to impact people's health outcomes today. Things like noise pollution, which you might not think about as a public health issue, certainly are. And so part of the problem, but also I think part of the potential is that public health is so big. It is all of those things. But what we need to do is help people understand it not just as an umbrella, but those certain parts of it that are really important, that are really impactful, where we can make change. And so how do we do it on certain things that we are able to be political, try not to be partisan? We identify things that can and should matter to people. We pull those levers. We work with politicians. We work with community groups. We do the grassroots work that I've seen so effective, particularly amongst a lot of the folks in MAHA. That's what we need to do. We need to find bite-sized chunks of things that actually work, as opposed to always be focused on public health being everything, this big umbrella that seems too unwieldy, too hard to move that political ship. It's the things underneath it, those components that we need to identify and make action on.
Ezra Clyde's been writing and podcasting a lot about what the Democrat Party should do to go forward. Everyone's trying to, on that side of the political spectrum, is trying to just piece together, like, how do we survive? How do we make a comeback? There was a big report that was released the other week called Deciding to Win, which everybody grabbed and read. And there's lots of prescription in there as to what the party should do. One thing they touched on that you touched on, which is they touched on Democrats often come off sounding like a scold, like they come off condescending. And the moment you tell voters, you're wrong and I'm right, and let me just explain it to you, they're like, we're out of here. And you wrote, speaking of public health, the move here isn't to scold Americans into collectivism. It's to suggest that the history absolves public health of past failures. Like, just talk about that attitude. Like, I think a lot of people close their eyes, they think of public health, and they're like, those were the really annoying people, the really annoying elite people who told me I couldn't go to work, or the bowling alley had to be closed, or my kids couldn't go back to school. Like, it was like a scold. You had to fall in line and do these things. How do you get past that? Because I think that, just at a real level, like, that's what people think of public health.
I think that's fair, right? Public health it's in the background. It is invisible. And so again, to this point that, if the only time you see something or someone is when they come up to point their finger at you and say you're doing something wrong, and the 99% of the time when they're in the background helping you, supporting you, doing great things for you, and you don't see them, I think it's going to be really hard for people when they only see that person come out and point their finger in their chest and say, no, you got to do this, when they don't see everything else that they're doing behind closed doors or in the background to make them healthy. And so I think part of it is that, like, making our shield visible, so that people realize that it's not just about the scold. But the other thing that I want to know is that, like, we need to be better about explaining the political implications of the impacts on public health, so that people understand that right now, if you look at where ACA premiums are going to go up, not just across the country by about like 114%, I think, according to a KFF survey, but like in places like South Florida, where the impact on hospitals is going to be disproportionate in a lot of rural places where you see, a lot of natural coalitions and places where we can go in as a community, as a public health community, and talk about what this impact is going to be, why we need to, and think about the political action that we need to take to prevent those, to talk about how we turn those things back. And so I think that's part of it. I also think that, and I suspect a lot of my colleagues will probably not appreciate this metaphor, but what I've noticed over the past 6 months is that people have talked about MAHA as a big tent. MAHA talks about MAHA as a big tent. And when we, from the outside look in, we probably see this mix of people concerned about environmental stuff and red dye 40, and then like carcinogens and all the, and then the back, maybe there's some like anti-vax folks. And partly by listening to your show, by having conversations, by doing more and looking more into this, I've realized that, like, it's a big tent, sure. The parts of the tent that we're primarily concerned about are pretty small in the back. Like, the anti-vax community is relatively small within the MAHA community, even if it's there and persistent. But what I've seen a lot, particularly from a lot of people I really trust and respect, has been kind of us on the outside of public health, and people who might be curious and willing to step out and say, actually, I'm not associated with the anti-vax folks. What I really want is good food, but not this stuff. People really willing to kind of set their foot out. And then us in the public health community ready to scold and ready to say, MAHA, we're not going to do that, or we're not going to be affiliated or associated with anything that we profoundly disagree with. And I think we need to be thoughtful about welcoming people out of the tent in a way that is inclusive, about finding and highlighting programs, exactly what you all were written up for in the MAHA report about working together in East Palestine, trying to find coalitions that may not agree on everything. I will not agree with people, even in public health, but let alone in MAHA, on everything. But we need to find more opportunities where it's less about wagging our finger and more about, beckoning people to say, look, I understand that you believe these things that I don't believe in, but we see eye to eye on these 2 or 3 things, and I want to work together on them. And that's how I think we end up right now making a path forward that not only is impactful, but also creates the conditions for trust, so that on those other things that we may disagree on, we have a space where we can have those conversations and hopefully work to make things better. There are real concerns right now. I'm not going to paint this kumbaya moment where we just need to work together and we can move forward. The cuts have been horrible. They've been damaging, and the impact of them is going to be everlasting. But I also do believe that there are people in my world that think progressively less so, but still like, all right, we get through this. If we get through this, if there's still a CDC, and if we still have these things, then like we get someone else in office that's not RFK Jr., and then we put it all back in place. And I think that there is that idea that MAHA is a thing that's powerful and it identifies some things that we also care about. But like the things that we really, really need and really, really care will all go back into place once we get back into something normal. And what I have progressively recognized through conversations, through surveys, through everything else, and just kind of paying attention in this space for the past 6 to 7 months is that like MAHA is here to stay. A lot of the things that MAHA wants is here to stay. I see them as an incredibly politically active group that I would like to see more action from not just like MAHA, but like anyone that wants to do public health, whatever umbrella you fall under. We need more of that grassroots organizing. We need more pulling in of that potential. I think there are parts that are not good faith, that are using false information and unscientific claims, that are hiding beneath this idea of like, quote, gold standard science, that I think just are not the case. But I do believe that there's a big part of what MAHA has identified, environmental stuff, food stuff, all this, that like the majority of Americans really care for. And no matter what happens, should MAHA fall tomorrow, these ideas are not going to go anywhere. We as a public health field are going to have to kind of move past this moment, recognize how we build them in, do it in a way that gets action so that people continue to support our field. One example that I've given is that you look at the NIH and how it has been attacked in this administration. And I've heard so many people come out and say, the NIH, it creates $2 or $8, whatever it is, and return on investment in economic activity. It's great in all these different states around the country. We need the NIH. It's not just good for science, but it's good for economics. And when I hear that, I kind of laugh because I think about conversations I have with people like my parents. They're like, the NIH doesn't do anything for me, right? Like the NIH does a lot. And then it creates these really cool medicines and does all this research. Then it sells it to a pharmaceutical company. And then they make a bunch of money off it. And like, I support with my taxpayer funding this research that ultimately gets done. And then we sell it off to some company and I can't even afford the damn thing. And I think that's a bit reductive and, kind of a very basic understanding of some of these things. But the reality is that like, if we want people to fight for the things that are really, really important, we need to make them important to them. We need to show that we're working for them. I think healthcare, we should not undermine how important it is going to be. Maybe not even in tomorrow's election, but the election a year from now, if things go forward and we have millions of people for the first time losing access to healthcare in this country. Like we need a moment. I think people are dying right now. What's killing people is not the quote politicization of public health, but our unpolitical activity towards arguing for things like broader access to better care for people, not just through medicine, but through public health resources.
Yeah, there's a Navigator poll that we did a whole episode on that kind of blew our minds. I want to read you one number, just picks up on that point. 91% of Democrats, 77% of Republicans, 83% of independents, and 80% of MAHA curious people in America right now agree that good health care is a human right. So there's political will there that kind of buttresses what you're arguing.
It's the easiest argument to make. And if you imagine a decade ago, those numbers did not look like that.
No.
We have nearly universal agreement that healthcare is a friggin' human right. We should not only talk like it, but we should like canvas and mobilize around it because it is. As someone that works in the system and knows the value of it and how important it is a human right. And we need to work and like advocate it for it being such now more than ever. And I think what we'll see over the next year as people lose access, as we see the impact, we're not going to be healthier, right? There's going to be a whole host of people that are not healthier. And we need to work on this. We need to be here and we need to advocate for this. We need to like call it, how do we actually make a healthy system? How do we make America healthy again? Maybe we need a different title or a different name or a different figure, whatever it is. But there is a path forward here. There's an opportunity that there hasn't been in the past. And I will say that I worry that if we continue with the status quo, and if we think about public health and MAHA as the same dichotomy as we think about public health and medicine, we risk losing this moment, not just MAHA, but public health more broadly. And the more I see things like Congress people call for the resignation of RFK Jr. and make this into Democratic Congress people and make this into a partisan issue, the more I see RFK Jr. tweeting from his own, Twitter account about, the Democratic-led shutdown, as opposed to both of these groups realizing that, like, they're both kind of here to stay. We need to see where this overlap is. There are parts of it that we don't like, but we are not going to be able to protect those parts if we don't protect the middle. And there's so much of this middle that we are not working on together that I think we need to move forward. One is clearly obvious. The number you just said, Tom, like, holy crap, make sure people have access to healthcare. It's a damn human right.
I can't stop smiling. I know this is an audio thing, but can you guys hear me smiling? I'm smiling hard. Because, like, Craig, what you're saying is just music to my ears. And the truth is, it is literally the pulse that makes our show go. What the last few episodes, we just recorded this episode about East Palestine and the work that's being done. And ultimately what I'm hearing you say, and it gets to your point about what you were saying about NIH and your dad and everything, is like, people want to feel value in their lives. They want to feel like something is adding value to their lives. And I know that sounds really sort of simple to say, but I actually think about ways in which I feel value in my life. Like when the garbage gets picked up, like, regularly, when the streets are clean, when I go into my doctor's office and medications are available when I need them, when I'm able to have access to healthy food and I don't just have junk all around me. Like, it's a framework. I know it seems very individualistic, and maybe that's where we get a little bit kind of caught up, but what is the value proposition that we all have for the American people, for just the people on the ground? Anyway, I just wanted to just kind of say, like, give you an amen. Maggie, I didn't mean to interrupt.
Craig, I just wanted to know, I really love how you framed this and how we have to find this common ground. And you talked earlier about bite-sized pieces to move that forward. So what are tangible bite sizes that we can rally around public health and MAHA to drive these things forward?
Yeah, I think there's a couple things. One is as we mentioned before, like, we should push and support some of the things that are being advocated for, like the ending of direct-to-consumer advertising, the removal of money from medicine. I don't think, quite frankly, politicians, particularly if you're a Democratic politician and you are trying to, like, undermine and fight back against RFK Jr. at this point, and you are taking a bunch of money from pharmaceutical companies, like, I think it makes it hard for you to be a trusted interlocutor. So I think calling that out and recognizing that despite how often medicine says that it wants to be above politics or is above politics, you don't go to your doctor and ask if they're a Democrat or Republican. You don't think about their partisan values. We think about ourselves as above politics. But I think what we really need to do is recognize that all this is, in fact, political, and that we need to remove a lot of that influence from pharmaceuticals, from a lot of this concern around influence. I think the other space where you hear a lot of anger and frustration is on the environment, right? I can't think of any place where we all have shared concerns. The MAHA community has brought up concerns around environmental pollutants and things, in our rivers and in our air and in our water at the exact same time that we have seen the EPA hobbled a lot of long-term protections rolled back. Quite frankly, I don't think RFK Jr. can or really is doing a lot on a lot of the environmental concerns that people in that movement have identified. This is a great opportunity for us to work together on things exactly like this, things like you've highlighted in your last show. I think there's a whole host of spaces where exactly this, like, we highlight the things where we have shared concerns. We all want healthcare. Healthcare as a human right. A decade ago, that was meant to be polarizing. And this idea that, like, you needed to work for it. At the time now when we're talking about how people shouldn't have benefits because, they're not working or they're not able-bodied, the fact that the overwhelming majority of people are willing to say that this is a human right represents an opportunity for us to not only make it a human right, but for us to create the systems that, Brenda, you pointed out. You're an individual and you shouldn't be thinking about as how it impacts you as an individual. That's okay. But we need to create systems in which individuals can thrive because of the community framework that has been put in place, where individuals can get healthy, not just because of access of individuals to things like healthcare and the medicines they need, or et cetera, but because the system exists that supports the collective as well as the individual. It doesn't have to be one or the other. That's what we need to create, and that's what we need to work toward.
Craig, you wrote about, I found this really interesting, this whole story about Robert Koch, I believe it was his name. Yeah. And how when he found the bacterium that was the cause of TB, that was a great thing, but it was a big shift for public health. Suddenly, all this energy about cleaning up our streets and sanitation, like that starts to recede. And then all of the energy and focus and excitement is on like what you see through a microscope. And it's the bacterium. We got to focus on that. So this was a great thing for science, but not a great thing for public health in the way that humans sort of, took this and ran with it. How do you think about conversations around like wearable technology? Like we can get the bio information from an individual and their disease and their risk. When you hear RFK Jr. or others say, wearable technologies are great, we can really create individual profiles. Is that sort of the antithesis of public health? Like, are you worried about that? What are you hearing when you hear that approach to health?
I think in this context, I have heard and seen a lot of focus on the individual as responsible for your health, which is true, but the individual at the expense of the collective. Do I think wearable devices are going to be what, turns us into a society where life expectancy increases by 10 years and we're all have much better health? No. So I think at an individual level, it can be beneficial, sure, although I think the data on that still is out. What concerns me more on things like wearable tech is obviously, the privacy issue, what that ultimately ends up doing, how that data gets collected, and how that ends up making decisions about other people's health. And so how, we have RFK Jr. has called for, he has mentioned, in a couple of years to have people with a lot of wearable tech. And a lot of people push back on that because they don't want that, understandably. But what happens when all that information gets uploaded, when all that data is collected? One, who owns it? What do they do with it? How does it, turn into being marketed towards you? But then also, who's reflected in that data? Is it primarily wealthier people that are able to spend thousands of dollars on all this tech to, kind of hack their life? And does their lived experience then become the data set that's used to determine access for other people in terms of health interventions, et cetera? The one thing that I've written on kind of connecting the past with the future is what is happening around health and AI in this country right now. And my concern around things like the pulling of the word equity from hundreds of grants. If you saw a Stat News piece a couple of days ago, over 700 NIH grants had to change their title or their focus. And the result was that you're going to have less focus on things like LGBTQ populations or, other equitable concerns. And the one thing that I worry about right now is that regardless of what our politics are, regardless of whether our partisan politics are, we all need to recognize that equity remains an incredibly important issue, that pulling out funding for issues of equity should not have anything to do with our politics, but it should be a recognition that different communities have different lived experiences, different access to healthcare, different access to public health, and that we all need to have overlapping concerns with how we address them. And if we don't, what we create is this data set that is not reflective of our population. That data set then gets put into an AI model that determines health decisions and health outcomes in clinics and public health departments and in hospitals. And ultimately, I think leads to worse outcomes, could potentially lead to worse outcomes for a lot of people. So I have concerns over the wearables. I don't think that it is the future for a lot of folks. I think for some people who may have mobility issues, who may be at home, I think the digitalization of health can be beneficial, but much broader, I don't see it as transformational as Robert Koch looking under the microscope in 1882 and seeing this TB bacilli and completely reframing how we think about and do health.
For sure. Listen, Craig Spencer, you are a delight. For those listening, having someone like Craig speak so honestly, so openly, he may take some flack from his own tribe for some of the things he said here. And I hope that people recognize that this is a time where, we really honor and admire people who speak with that level of just honesty, and it takes courage to do that. And I also hope that people, listening from MAHA, our friends in MAHA, see that there are so many great freaking people who work in the space of public health. We are the first people here on the show to, be critical and really demand change and breaking of the status quo. And we can be pretty tough on public health. You guys know that, right? But the truth is we're doing it because we want it to work. We want it to, like good people like Craig and Maggie and others out there, we want to set them up to succeed. And I hope that y'all are also seeing the incredible heroes out there who are trying to fight for the betterment of this country, and that we all kind of have to be in this together. I couldn't agree with you more, Craig. I just want to thank you so much for coming on Why Should I Trust You, Craig?
Thank you for creating these conversations and for, introducing me to ideas and opinions that I probably wouldn't have seen otherwise. So thank you all for doing this and creating a conversation and a space for us to think about these things.
A huge thank you to Craig Spencer and to our listeners for the special edition of Why Should I Trust You? I am Brynda Adhikari. He is Tom Johnson. She is Maggie Bartlett. Dr. Mark is seeing patients today, and he will be back with us on the next episode. Please send questions, comments at questions@whyshouldItrustYou.net, and you will see us back here on Thursday.